Hey folks, and welcome back to the third video vlog of my, based on my written blog on basicsofOrtho.com, physician assistants in orthopedics, what we do and how to become one. In the first video of this series, I answered what motivates a PA to go into orthopedics, and the second one I answered what do PAs do, and in this third one I'm going to be talking about the pros and the cons of being a physician assistant in orthopedics. So let's go ahead and get started with that. A lot of this you may have heard in the other two episodes that I did, but I'm going to put it specifically in the pros and the cons for this one. So just like every other specialty or career, there's good things and there's bad things about each and every one of them. These pros and these cons within context can vary depending on the person. Some people may view something as being a pro of that particular specialty, while another person may look at it and say, no, that's not a good thing. I don't like that at all. So this answer can vary from person to person, and this is my interpretation, but I also threw in a little bit of metrics from some papers that have been done that give folks some numbers. So let's go ahead and jump into those. I have 6 pros and I have 3 cons. So the pros, and with the first thing I'm going to list as a pro, number 1, in general, orthopedic or PAs in orthopedics have a better than average job satisfaction, that is. And this is coming from a 2019 PAOS, or Physician Assistants in Orthopedic Surgery Practice Salary Survey report, and they found that 97% of PAs in orthopedics were either very satisfied or satisfied with their choice to be a PA. And in that same report, 89% reported either being very satisfied or satisfied with their current employment. So what does that mean? That just means that PAs in general in the orthopedic setting are happy with, number 1, being a PA, and number 2, with working as a PA in orthopedics. So number 1. Number 2, many patients get better, and healthcare providers like it when their patients get better. Folks that take care of a lot of patients with diabetes or with hypercholesterolemia or hypertension, those patients, yeah, you manage them, but it generally doesn't go away. In orthopedics, a lot of what we treat goes away. You may say, well, don't you treat a lot of arthritis? That's chronic. Well, yeah, it is, but if you do a knee replacement, that knee arthritis is gone. Yes, you can have potential adverse events after knee replacement, but approximately 97% of the time you don't. So many people get better, and the JOPA report, a Journal of Orthopedics for Physician Assistants in 2016 executive brief, that was a big pro that they listed. Number 3 was the diversity of work type. I touched on this quite a bit in the last number 2 video series, but diversity of work type, including surgical assisting, working in the clinic, doing clinical procedures, working in the hospital, a lot of that is seen as being a positive attribute of the orthopedic field. Number 4, and this, in a lot of cases, the PA needs to get some years under the belt, but PAs in orthopedics can have a fair amount of autonomy, particularly in the clinic setting. Number 5 is, I also touched on this one, is in a previous episode, but PAs in orthopedics generally have a pretty good salary and benefit scale. The 2019 AAPA, or American Academy of Physician Assistants, salary report, orthopedic surgery ranked 13 of 52 in terms of 50th percentile salary, that's plus bonus, among practice specialties recorded, and the dollar amount for that was $110,000. The same year, the 2019 Physician Assistant in Orthopedic Surgery Practice Salary Survey report had a median and a mean total compensation of $115,966 as the median, the median, and then $113,000 as the mean. So PAs do pretty well financially. So that's definitely a pro. And then the final pro, number 6, is there were other reported benefits of working in the field, including that the work can be challenging. people that are consistently challenged, they tend to think more, and that stimulates them more and is more enjoyable. Whereas folks doing more menial tasks consistently, repetitively, tend to get bored with what they're doing. And then the final was a collegial work environment. In the orthopedic setting, which I've done for nearly 15 years, yeah, there's generally almost a good team environment, if you will. So that can be enjoyable. So those are our pros. Our cons, as I mentioned, there are 3. There's not a lot of published data related to cons of a particular specialty. So this really is more of my own perception. And again, these are mine, and that can change. You may say, no, that's not a bad thing at all. I actually like that. But this is in general and in my terms. So number 1 is long hours and days. So with all that work that needs to be done, as I've previously mentioned, hospital work, clinic work, OR work, even urgent care coverage, that's a lot of work that needs to be done. And sometimes it takes a lot of long hours to do it. And there are many weeks that you have multiple 10 and 12-hour days. You may say, well, 10 and 12-hour days, that's pretty standard, right? Well, it is standard for more shift work. You may have 4 10-hour days or 3 12-hour days. Most PAs in orthopedics, in my experience, don't work shift work. They work a salaried work week and get paid for 40 hours a week. And so we don't do shifts in most cases. And that's just our normal work week. That doesn't include call. And in the 2018 PAOS report, there was a median hours work per week of 45, and that didn't take into account the number 45 hours a week. That didn't take into account the call hours per week, which that was consisted of a mean of 19.2 hours and a median of 12 hours per week. So you've got that 45 hours a week, normal work week, and then you've got 12 to 19 hours of call on average, in that study. So that, in my opinion, is a con. Number 2 is, I just mentioned call in number 1 is being part of the reason we work long hours. Call in itself, in my opinion, is a con, which a lot of people would, but other people may say, well, that's just part of the job. And yes, it's true. But 56% of PAs in orthopedics take call, with 91% of those being on weekends, 87% being weeknights, and 55% of PAs in orthopedics that take call doing it during daytime hours. And these call duties can range from simply just taking patient calls. You can get inpatient calls from nurses about post-op patients. You can do surgical assisting in some cases. Inpatient and ER consults are also possible or possible call duties that one may perform or be tasked with. And then the final and third con, in my opinion, is the additional duties. So what do I mean by additional duties? Well, in my experience, when a surgeon or a group wants to expand services or hours to, quote, improve access, those increased hours or the urgent care that wants to be formed, they're largely tasked to PAs. And ideally, in a perfect world, the PAs would be hired to cover that, and the existing PAs would not have to shoulder that burden in addition to their normal duties. But in some cases they are, and I've experienced that personally. And when that happens, there usually is some additional compensation, but for folks that aren't financially driven or motivated and are more time and quality of life and work-life balance motivated, that compensation doesn't pan out. So that is my third con. So those are my 6 pros for being a PA in orthopedics and my 3 cons. So after hearing that, if you're still considering orthopedics, I do think it can be a very challenging and a rewarding career choice. I hope this gives you something to think about and helps you in your decision. So that concludes my number 3 vlog related to what it's like being a PA in orthopedics and how to become one, which my next number 4 episode in this series is going to address just that. How do you become a physician assistant in orthopedics? I'll see you for that one.